It's metabolic inflammation that's the underlying driver. It's 2/3 of the healthcare expenditure, about $1.3 trillion a year. It's everything from anxiety to depression to high blood pressure, obesity to diabetes, schizophrenia. It's all of these things. It's most of the solid tumors that we have in our body. It's the vast majority is driven by metabolic dysfunction. And from an integrated lifestyle, which is what you guys do, this makes sense. You're going to grasp onto it immediately. Really what it is a metabolic switch that's happening between M1 and M2 stages. It's between pro-resolving and pro-inflammatory. When you switch into a pro-inflammatory status and you're more glycolytic and less oxidative phosphorylative, you have issues. And these issues are everything from endothelial dysfunction to increased risk of cancer, to increased risk of diabetes, to increased obesity. And we have these pretty well defined. This isn't something that we pulled out of our back pockets. What we've changed though, is we're able to get to the information on how to help these patients quicker and more rapidly and implement specific lifestyle protocols that are tailored to them. And that's what the entire basis of the Measura protocol is. It incorporates all of the metabolic pathways that we know of and puts them in one place, and then uses metabolic testing to figure out which ones are the most likely to give you an outcome. And at the same time, it does it in a way that's reimbursable. Because historically, people give lip service to lifestyle. You know that when you have hypertension, the first thing you're supposed to do is tell a patient lifestyle intervention. That's really the last thing that anybody ever hears. The first thing that they usually get is a beta blocker, or they get an ACE inhibitor, and they rarely will get lifestyle intervention of any kind. When they become diabetic, the first thing that gets thrown at them is typically a glipizide or a metformin, and if it's high enough, they'll get insulin, and now they'll get Ozempic. But nobody talks to them about a lifestyle intervention, despite the fact that the lifestyle intervention is actually fairly more significant and is more beneficial for them. The first thing that people do when they get high cholesterol is they get a statin thrown at them. Well, a statin is only going to increase your lifespan by 4.1 days on average, and your risk of diabetes just went up by 20 to 30%, and your risk of cognitive impairment just went up by 40% by being on a statin. So those are the things that we get ahead of to get treatment.